You've probably chalked it up to a lot of things. Maybe you've told yourself it's stress, or burnout, or just getting older. The dry eyes that don't seem to go away no matter how many drops you use. The dry mouth that wakes you up at 3 in the morning. The fatigue that coffee doesn't quite touch. And then the brain fog. That sense of reaching for a word and finding nothing. Of walking into a room and forgetting why you're there. Of feeling mentally slow than you used to be. Separately, each of these things has a perfectly ordinary explanation. But together, in some people, they may be pointing towards something that often goes unrecognized for years. In this video, we're going to talk about Sjogren's syndrome, what it is, how it may show up in ways people don't always connect, and 7 common oversights that may make navigating this condition more difficult than it needs to be. This is not a diagnosis. These patterns can have many different causes, but if any of this resonates, it may be worth paying closer attention. Before we get into the oversights, it helps to understand what Sjogren's syndrome actually is, because most people, when they first hear the name, picture something much simpler than it often turns out to be. Sjogren's, pronounced Sjogren's, is an autoimmune condition. What that means, broadly speaking, is that the immune system, which normally works to protect the body, begins to mistakenly target healthy tissue. In Sjogren's, this process is most commonly associated with the moisture-producing glands, the ones responsible for tears and saliva. That's why dry eyes and dry mouth are often described as the hallmark features. But here's what many people, including some who have been living with the condition for years, don't fully realize. Sjogren's is a systemic condition. In many individuals, it can affect far more than just the eyes and mouth. Research suggests that it may involve the joints, the skin, the kidneys, the lungs, and the nervous system. According to the Sjogren's Foundation, it's estimated to affect somewhere between 2 and 4 million people in the United States alone, and up to 90% of those diagnosed are women, though it does affect people of all genders. And yet the average time between when symptoms first appear and when someone receives a diagnosis can stretch to several years, sometimes longer. That gap is in part what this video is about, not the diagnosis itself, that's a conversation for a qualified healthcare professional, but the patterns, the oversights, the things people often don't connect. Let's go through them. Oversight number 1, overlooking brain fog as a symptom. You're in the middle of a sentence and the word just isn't there, or you reread the same paragraph 3 times and nothing sticks, or you have a meeting and by the time it's over, you can barely recall what was said. Most people dismiss this, especially if they're busy, especially if they're not sleeping well, especially if they're over a certain age. Brain fog, cognitive cloudiness, difficulty concentrating, memory lapses is so commonly attributed to lifestyle factors that it rarely gets taken seriously as a medical symptom. The problem is that brain fog doesn't have a dedicated checkbox on most medical intake forms. It's not easily measured the way blood pressure is, and because it tends to come and go, patients sometimes feel like they're exaggerating when they try to describe it. In people with Sjogren's, cognitive symptoms are well documented in the research literature. One study published in the journal Rheumatology noted that cognitive complaints are among the most frequently reported symptoms in Sjogren's patients, often described as impairments in attention, processing speed, and verbal memory. The exact reasons are still being studied. Some researchers have pointed to inflammatory processes that may affect the central nervous system. Others have noted the role of disrupted sleep, which is extremely common in Sjogren's, as a contributing factor. Chronic pain, when present, can also impair cognitive function over time. When brain fog isn't recognized as a potential symptom, when it's dismissed as stress or burnout, people may go years without it ever being part of the clinical picture. That can delay a fuller understanding of what's happening. Start tracking, not obsessively, but systematically. A simple note on your phone after notable cognitive moments, what you were doing, how you felt that day, whether you slept the night before, whether you'd been more tired than usual. Patterns over time tell a story that isolated moments don't. Oversight number 2, assuming it's just aging. At some point, most of us begin to normalize certain experiences by attributing them to age. Joints that ache a little more, eyes that feel drier, fatigue that doesn't lift as easily as it used to, a sense that recovery from a cold, from a stressful week, from a bad night's sleep just takes longer. These are all real features of natural aging, and for many people, that's exactly what they are. But here's the oversight. Some conditions that are more common in midlife can masquerade as aging, and Sjogren's is one of them. It most commonly appears in people over 40, and many of its symptoms overlap with things we're already inclined to write off. The result is that people may spend years managing symptoms piecemeal: eye drops for the dryness, ibuprofen for joint aches, supplements for fatigue, without ever stepping back to see if there's a unifying thread. This isn't just about getting to a diagnosis sooner, it's about quality of life. When the underlying pattern goes unrecognized, people may not be addressing the root of what's contributing to their symptoms. They may be treating effects rather than causes. The question worth asking isn't just, is this normal for my age? It's, is this pattern changing over time? Is it getting more consistent? Are multiple symptoms showing up together? Aging is gradual. A cluster of symptoms appearing with some regularity or worsening together may be worth discussing with a doctor, not as cause for alarm, but as information.
Oversight number 3, focusing only on dryness and missing the bigger picture. If someone does learn about Sjogren syndrome, they often learn about it through a single lens: dry eyes and dry mouth. And because those symptoms can often be managed, at least partially, with over-the-counter products, many people settle into a kind of symptom management routine without ever exploring whether more is going on. The dryness symptoms are the most visible and the most frequently mentioned in basic descriptions of the condition. They're easy to name, easy to treat at the surface level, and because relief, even partial relief, is possible, there's less immediate pressure to look deeper. But Sjogren's is, in many cases, much more than a gland problem. Research has documented involvement of the peripheral nervous system, the network of nerves outside the brain and spinal cord, in a meaningful subset of patients. This can manifest as tingling, numbness, or burning sensations, often in the hands and feet. The medical term for this is peripheral neuropathy. Some individuals also report what's sometimes called small fiber neuropathy, affecting the tiny nerve fibers that carry signals related to pain and temperature. This can be subtle, easily dismissed, and may not show up on standard nerve conduction tests. When people, or even clinicians, focus only on dryness, other symptoms may not get the attention they deserve. Nerve-related symptoms, fatigue, joint involvement, and other features of the condition may be evaluated in isolation rather than as part of a connected picture. If you're being evaluated for Sjogren's, or if you have a known diagnosis, it can be helpful to bring a full symptom inventory to your appointments, not just the most prominent ones. That includes nerve sensations, fatigue, cognitive symptoms, joint pain, skin changes, and anything else that's been consistent or recurring. The more complete the picture your provider has, the more complete the care can be. Oversight number 4, not tracking patterns over time. Symptoms that come and go are notoriously hard to communicate at a medical setting. You have a 10-minute appointment, the doctor asks how you're feeling, and in that moment, maybe because you've been relatively okay this week, you find yourself saying fine, mostly, when the fuller truth is more complicated. Autoimmune conditions, including Sjogren's, often have what's called a relapsing remitting pattern. Symptoms may flare, becoming more intense or more frequent, and then ease. This variability makes them easy to downplay during the calm periods and hard to describe accurately during the difficult ones. Without documentation, all you have is memory, which is imperfect and which tends to default to how you feel right now rather than how you felt over the past 3 months.
Without a clear longitudinal picture, it can be harder for a healthcare provider to recognize patterns, assess whether things are changing over time, or understand the full burden of symptoms. This isn't a criticism of anyone, it's simply how episodic symptoms work when they're not tracked. A symptom log doesn't have to be elaborate. Even a brief daily note rating fatigue, cognitive clarity, and any notable physical symptoms on a simple scale can generate meaningful data over weeks and months. Some people use apps designed for chronic illness tracking. Others use a simple spreadsheet or even a daily text to themselves. The format matters less than the consistency. When you walk into an appointment with 3 months of notes, the conversation changes. Oversight number 5. Underestimating the role of sleep. Poor sleep is so common in modern life that most people have normalized it to some degree. We accept that we're often tired, we compensate with caffeine, we tell ourselves we'll catch up on the weekend. But for people with Sjogren's, sleep disruption may be more than a lifestyle inconvenience. It may be a significant contributor to daytime symptoms, including brain fog, fatigue, and mood changes. There are a few reasons sleep may be particularly challenging in Sjogren's. Dry mouth can worsen overnight, leading to discomfort that interrupts sleep cycles. Dry eyes can cause irritation that makes it harder to fall or stay asleep. Joint pain and general discomfort can further fragment rest. There's also some emerging research suggesting that certain autoimmune processes may influence sleep regulation at a deeper level, though this is an area where the science is still developing. What's well established is the bidirectional relationship between sleep and inflammation. Poor sleep can amplify inflammatory processes, and inflammatory processes can disrupt sleep. In a condition like Sjogren's, this may create a cycle that's worth consciously addressing. Chronic sleep disruption compounds virtually every other symptom. Fatigue becomes heavier, cognitive performance declines, pain thresholds lower, mood becomes less resilient. When sleep is treated as a separate problem rather than part of the overall picture, the opportunity to address a meaningful contributing factor may be missed. Sleep deserves its own conversation with your healthcare provider, not just as a side note, but as a primary concern. This might include exploring whether dry mouth or eye discomfort is specifically disrupting sleep, and what options exist to manage those nighttime symptoms more effectively. Basic sleep hygiene practices, consistent sleep and wake times, limiting screens before bed, keeping the bedroom cool and dark, remain relevant here, but they work best as a foundation, not a replacement for addressing underlying contributors.
Oversight number 6. Dismissing subtle neurological changes. A tingling in the feet that comes and goes, a strange sensitivity to temperature in the hands, a sensation of heaviness or weakness in the legs that doesn't quite make sense. These are the kinds of symptoms people often struggle to describe, and struggle even more to take seriously. They seem too vague, too intermittent, too hard to pin down. Neurological involvement in Sjogren's is an area that has received growing attention in the research community. The peripheral nervous system, the nerves that run through the limbs and organs, may be affected in some individuals, sometimes even before other more classic symptoms become prominent. In some cases, these nerve-related symptoms may precede a formal Sjogren's diagnosis by years, which is part of why they get dismissed. There's no obvious connection in the patient's mind or the clinician's between a dry mouth and a tingling in the feet. It's worth noting that peripheral neuropathy has many possible causes. Diabetes, vitamin deficiencies, thyroid issues, and other conditions can all produce similar symptoms, so the presence of these sensations does not indicate Sjogren's specifically. It simply means they deserve investigation. Subtle neurological symptoms that go unaddressed for long periods may have cumulative effects on function and quality of life. And perhaps more importantly, when they're not communicated, they can't be evaluated. That limits what any provider can do. If you're experiencing sensations that are unusual, intermittent, or don't have a clear explanation, write them down. Note where they occur, how they feel, when they tend to happen, and how long they last. Don't self-interpret them, just document them. That documentation gives a neurologist, rheumatologist, or primary care provider something concrete to work with. Oversight number 7, not presenting the full symptom picture. This may be the most practical oversight on this list, and in many ways the most fixable. Most people, when they go to a doctor, present the symptom that's bothering them most at that moment. It's how appointments work. You have a limited window, you have a specific complaint, and you focus on that. But in a condition like Sjogren's, which can affect multiple systems and produce a wide variety of symptoms, the full picture often doesn't emerge until all of it is on the table at once. There's a normal human tendency to compartmentalize. The eye doctor gets the dry eyes, the GP gets the fatigue, the dentist gets the dry mouth, the neurologist, if you ever see one, gets the tingling, and no one has the full mosaic. On top of that, people often feel self-conscious about listing too many symptoms. There's a fear of being seen as a hypochondriac, so they pick the most pressing thing and leave the rest out. The result is that healthcare providers, even highly skilled ones, may be working with incomplete information. Sjogren's is notoriously underdiagnosed and delayed in diagnosis. Part of that is the nature of the condition, but part of it is that the dots don't get connected because they're never all presented in the same room at the same time. Before your next appointment, take 15 minutes to write down everything you've been experiencing, even the things that seem unrelated or minor. Not to self-diagnose, not to alarm your provider, simply to give them the most complete picture possible. A good clinician doesn't see a long symptom list as evidence of hypochondriac. They see it as data, and in complex autoimmune presentations, data is exactly what's needed. Here's what's worth holding on to as we close. Sjogren's syndrome presents differently in different people. Some experience primarily the classic dryness symptoms. Others find that fatigue, cognitive cloudiness, or nerve sensations are the more dominant features of their experience. And for many, it's a fluctuating, evolving picture that doesn't fit neatly into any simple description. That variability is part of what makes it so easy to miss, and why the oversights we've talked about today are so common. Overlooking brain fog, chalking everything up to aging, focusing only on dryness, not tracking patterns, underestimating sleep, dismissing subtle neurological changes, and never presenting the full picture. None of these are failures. They're understandable responses to symptoms that don't always come with clear labels attached. But awareness changes things. When you begin to notice patterns rather than isolated events, when you take your symptoms seriously enough to document them, you give yourself and the people caring for you something to work with. If anything in this video resonated, if you recognized your own experience in some of what we described, the most useful next step isn't a Google spiral, it's a conversation with a qualified healthcare professional. A rheumatologist in particular is the specialist most often involved in evaluating and managing Sjogren's and other autoimmune conditions. Bring your notes, bring your questions, bring the full picture. Paying attention to patterns is often one of the most useful steps towards understanding what your body is trying to tell you. If you found this video helpful, sharing it with someone who might benefit is one of the most meaningful things you can do. There are a lot of people navigating these symptoms quietly, often without a framework to make sense of them. We have more videos on autoimmune health, chronic illness awareness, and the science of how the body works linked below. Take care of yourself, and we'll see you in the next one.